Most kidney damage doesn't start with pain. It starts quietly, and it often starts with something you take because you're trying to feel better. And here's the part that surprises a lot of good, careful people. Some of the most common medications in America, including ones you can buy without a prescription, can stress your kidneys enough to trigger a sudden kidney injury or slowly worsen chronic kidney disease over time, especially if you're older, dehydrated, diabetic, or taking a few normal meds at the same time. Today, we're going to do something practical and protective. I'm going to walk you through 9 common medications and substances that can cause kidney damage, and more importantly, how to reduce your risk without panic, without fear, and without you randomly stopping medicines that might actually be helping you. And throughout the video, I'm going to give you a simple, patient-style way to think about your kidneys. Your kidneys are like coffee filters with blood vessels attached. If blood flow drops too low, or the filters get inflamed, or dehydration concentrates everything, the filters clog, strain, and your numbers start changing. All right, take a breath with me. In the next part, we'll start with number 1. NSAID pain medicines, what they do, why they can be dangerous in the wrong situation, and the safer decision rules I want you to remember before you take that next dose. Let's start with the has-shown kidney troublemaker that shows up in millions of medicine cabinets, NSAIDs. NSAIDs are non-steroidal anti-inflammatory drugs, common pain and fever medicines like ibuprofen, Advil, Motrin, naproxen, and higher-dose aspirin products. They can be very effective for arthritis, flares, back pain, headaches, and injuries. But the National Kidney Foundation warns that NSAIDs can harm the kidneys, and for people with chronic kidney disease, CKD, they can also build up as kidney function declines. Why this happens? Simple explanation. Your kidneys are filters that need steady blood flow to work well. NSAIDs can interfere with the kidneys' keep blood flowing signals. In the wrong setting, kidney blood flow drops, filtering slows, and you can develop an acute kidney injury, sometimes quickly. If you've been using NSAIDs and notice new swelling, rapid weight gain, much less urine, unusual weakness, confusion, or blood in urine, reach out to your clinician promptly. Now, let's move to #2, antibiotics. Most antibiotics are safe when properly prescribed, and you should never skip needed treatment out of fear. But certain antibiotics are known for kidney stress, especially in higher doses, longer courses, or when combined with other nephrotoxins. A 2023 review on antibiotic-induced nephrotoxicity discusses kidney injury risk with agents like vancomycin and aminoglycosides, and prevention strategies such as monitoring levels and avoiding other kidney-stressing drugs. 2 common kidney watch antibiotics, often in hospitals. Vancomycin to NAS. Kidney injury risk is well documented, and risk rises with higher exposure and when paired with other nephrotoxins. Monitoring drug levels is one way teams reduce risk. Aminoglycosides, like gentamicin. These can be effective, but have long been associated with nephrotoxicity risk, especially with prolonged courses and in vulnerable patients, so monitoring matters. The outpatient surprise, Bactrim TMP SNX. Bactrim is a common antibiotic, but it deserves respect in older adults. Trimethoprim can raise potassium by acting like a potassium-sparing diuretic in kidney tubules. Studies report clinically significant hyperkalemia risk, especially when combined with ACE inhibitors or ARBs. TMP SMX can also raise serum creatinine by reducing creatinine secretion, which can look like kidney function worsened on labs. Now let's talk about a category that confuses a lot of people over 55, because it sounds like a contradiction. Some blood pressure medicines can protect your kidneys and still cause kidney problems in certain situations. I'm talking about ACE inhibitors and ARBs. You may recognize names like ACE inhibitors, lisinopril, enalapril, benazepril, ARBs, losartan, valsartan. These medicines are extremely common for high blood pressure, heart protection, and in many patients with diabetes or early kidney disease, they can be part of a kidney protective plan. So why are they on this list? Because the problem isn't that they're bad. The problem is that they change kidney filtering pressure. And if your body is dehydrated, low on blood volume, or your kidneys are already under stress, that shift can reveal a problem quickly. The simple way to understand it, your kidneys filter blood through tiny filters. Those filters work best when pressure and blood flow are stable. ACE inhibitors and ARBs can reduce pressure on one side of that filter. For many people, that's beneficial long-term, especially if there's protein leaking into the urine. But if you're dehydrated, on a water pill, sick with diarrhea, or have certain blood vessel issues, that pressure drop can be too much and your filtering rate can fall. That's why clinicians emphasize monitoring kidney function and potassium when starting or adjusting these meds, especially in older adults. What you should do if your doctor prescribes an ACE inhibitor, or ARB, if your clinician recommends one of these medicines, don't panic. Instead, do what smart patients do. Ask for a simple monitoring plan. Here are the exact questions I'd want you to ask, in plain language. If you have heart failure, lung congestion, or significant swelling, diuretics can keep you breathing comfortably and prevent hospitalization. So we're not saying don't take them. We're saying take them with a plan. Now, here's why I'm spending time on ACE inhibitors, ARBs, and diuretics together. Because when you add an NSAID on top of them, you're moving toward that triple whammy risk pattern that has been linked with acute kidney injury. So if you remember nothing else from this section, remember this. If you're on a blood pressure medicine ACE and a water pill, do not casually add ibuprofen or naproxen without asking your clinician. Next, we're going to move into the higher stakes categories. Chemotherapy agents and imaging contrast dyes, and I'll give you practical questions to ask before you get the infusion or scan, so you're protected without delaying needed care. Now we're moving into two situations where people over 55 often feel the most powerless because the words themselves sound scary. Chemotherapy. CT scan with contrast. And if you're watching this for yourself or a loved one, I want to slow this down and speak to you the way I would in a calm clinic visit. You can need these treatments or scans and still protect your kidneys. The goal is not fear. The goal is a plan. Because kidney injury in these settings often isn't random. It's frequently tied to a short list of predictable risk factors like dehydration, existing CKD, diabetes, older age, higher doses, or stacking other kidney-stressing medications. Let's start with chemotherapy agents.
Cisplatin can irritate the
from the
kidney
original
tubule,
list,
so your
chemotherapy
South Asian
agents
male
that can affect
treatment
the
team
kidneys.
uses
Chemotherapy is sometimes a life-saving necessity, but certain agents are known to be more kidney tough, meaning your care team needs to actively prevent kidney stress. Two of the most commonly discussed examples are cisplatin, high-dose methotrexate. Why hydration is not optional. Cisplatin is In the next part, we'll cover two more categories that many people don't connect to kidney health until it's too late. Mood stabilizers like lithium, alcohol and illicit drugs, and the very real blood pressure and blood vessel pathway to kidney failure. Hashite, mood stabilizers, and kidney health. Lithium can be a life-changing medication for bipolar disorder and certain mood conditions. For many patients, it's the difference between stability and suffering. But the medical literature is clear on one point. Long-term lithium exposure can be associated with kidney problems in some people, which is why routine monitoring is recommended. This doesn't mean everyone on lithium will develop kidney disease. Many people do well for years. But it does mean you should treat lithium like a medication that deserves respect, not fear. The two main kidney issues lithium can cause: gradual decline in kidney function, in some patients not. A review discussing lithium and chronic kidney disease explains that a subset of long-term lithium users can develop CKD, and it emphasizes clinical decision-making and monitoring rather than panic. Always thirsty, always peeing. Dehydration risk, nephrogenic diabetes, insipidus. Lithium can reduce the kidney's ability to concentrate urine, leading to excess urination and thirst, and if fluids aren't managed properly, it can cause dehydration and abnormal sodium levels. A 2025 case-based review describes how lithium-induced nephrogenic diabetes insipidus can lead to significant polyuria and dehydration. If you've ever heard someone say, "I'm on lithium and I pee constantly," that's not just an annoyance. Over time, that fluid loss can become a kidney stressor, especially during heat, illness, or if other medications are added. #9. Alcohol and illicit drugs can damage kidneys, often through blood pressure and dehydration. Now, let's talk about the final category, because it's bigger than people realize. Kidney damage from alcohol and drugs often happens through indirect pathways, raising blood pressure, triggering dehydration, causing muscle breakdown, constricting blood vessels, exposing the kidneys to toxic adulterants. Alcohol, the blood pressure bridge to kidney disease. You don't have to be an alcoholic for alcohol to affect kidney risk. The National Kidney Foundation notes that even 2 drinks per day may increase the risk of high blood pressure, one of the leading causes of kidney disease. And the CDC includes alcohol moderation as part of living with CKD because alcohol can increase blood pressure. So again, the point isn't to overwhelm you. It's to make the risk real. Kidney injury from illicit drug use is not rare, and it can be severe. You've made it to the end, and that alone tells me something important about you. You're not the kind of person who waits for a crisis. You're the kind of person who wants to prevent one. And with kidneys, Prevention matters, because unlike a headache or a fever, kidney damage can build quietly for months or years before you feel anything dramatic. So let's pull everything together into a simple, usable plan. Your kidneys are not just filters. They are living tissues that depend on good blood flow, stable hydration, healthy blood vessels, and the ability to clear medications and toxins efficiently. Many drugs on this list become risky when one of those supports is missing, especially after 55. When dehydration happens easier, blood vessels are stiffer, and medication stacking is more common. Now I want to hear from you. Which one surprised you most? NSAIDs like ibuprofen, antibiotics like Bactrim, blood pressure meds, or contrast dye? Type it in the comments as, "The one that surprised me was," because your comment may be the exact wake-up call someone else needed. If this helped you feel more informed and less anxious about kidney health after 55, subscribe for more calm, science-backed guidance so you can protect your health without fear.